Good morning. Welcome to the monthly EMS training. Today we're going to be covering what's required for your IFTs. In every ambulance, there is a new IFT binder. It looks like this. Inside this binder, you will find all of the information pertinent to your IFT transfers. We will be taking emergent ALS IFTs from Seneca to wherever the receiving hospital may be. Your captain or battalion chief will authorize the transfer prior to you leaving. Make sure that you have been contacted by your captain or battalion chief, not just by the hospital. They need to make contact with the office or the on-duty captain prior. All right, inside this binder, when you open up the first page, it is going to have on here the critical care paramedic standards of care. This is basically anything that you can do as a critical care paramedic. It's a guideline for you as an MICP. We will be putting you guys through the NorCal MICP class as well. The next page here is your role as a paramedic. Everything in green is what you can do as a medic or as an MICP. If it is not green, then it means you have to make base contact for the two yellow sections on here. It has medication lists, things you can give, things you cannot give, listed in that section of the form. The next form here is your IFT paperwork list. This is what is required when you go to pick up the patient from the hospital. All 5 of these things you need to make sure you have from the hospital before you leave. This is to serve as a checklist. The next form here is your IFT information form. As you are receiving your information on your patient or on the IFT, all of these things need to be checked off. Again, if you have any questions or you feel anything isn't right with this patient, or if you just feel it's out of your level of care, please call the on-duty captain or the BC immediately. Do not take the patient from the hospital. Do not accept transfer of care until after you have talked to the battalion chief or the captain. If you have any questions on any of this paperwork, please let us know. Most important thing that you're going to get from the hospital is going to be the destination, hospital address, and remember to get the phone number of the ER so that you can call report. Our radios don't have all of the hospitals programmed into them, so you cannot use the radio to call everywhere. Next is going to be the location that the patient is going at that hospital. Typically, we will not do an ER to floor transfer. That is going to be up to SIMSA or another ambulance company to do. We will take them if it is an emergent transfer. Most of ours should be ER to ER. The receiving doctor, their name at the facility. So if you have any questions, you can always call the facility and ask to speak with that physician as well. Chief complaint of the patient and the time that they arrived in the emergency room. That's important for your documentation. Medications given by the transferring hospital while they were in the ER, the amount of the medication or fluid, and the times that they were given. Also super important for your documentation. Doctor's orders for medications, fluid, or oxygen during transport, and if there's any orders to have the patient on the cardiac monitor or what kind of monitoring is required. And lastly, is the patient stable or unstable? And have they been stable or unstable the entire time in the ER? Very important to know any changes in your patient since they've been in the emergency room. Again, if you have any questions or feel uncomfortable at all, call the on-duty captain or battalion chief. Next in this binder is going to be your IFT protocols. It shows everything you can do on an IFT as an MICP. It gives all of the authorities to do everything, medications that you can take, adjustments you can make to drips, things you cannot adjust, you can only turn off. Everybody should familiarize themselves with these protocols. We will be having a protocol test on these protocols in the next month or so, so I encourage you all to go through this binder and read these protocols. All of your IFT protocols are in here. If there's a medication that the patient is on that is not in this protocol or is not in your standard protocols, you cannot take that medication. Call the on-duty battalion chief or captain immediately. This is in the very back here, you have a drug dose list. This is for reference only. This gives you all of the drugs that we can give as paramedics and the dosages. Breaks it down by patient weight if necessary, and also has a pediatric section in the back to help with any pediatric patients as well. As you look through this, you'll see every drug that we use on the ambulance is in this section here. These are your IFT specialty drugs. Everything listed in the IFT specialty section is what you'll be dealing with on IFTs. There's 2 pages for that, and that's it. Again, your pediatric is color-coded in the very back of this binder. And again, this drug list and medication dosage is just for references. You should know your protocols for giving medications prior to giving them. As you arrive at the hospital, you should be getting a packet. Will look similar to this. It'll say ambulance on it. You should also have a second packet that says receiving hospital. Inside this packet should be a patient report. It should say final report, and it should have everything in it required for that patient. Everything that was given, the diagnosis codes, your doctor's notes, everything for you to read and understand what is going on with your patient. Should have lab values, x-ray results. The one that's going to the hospital should have an imaging CD in it. So any imaging that was done by the transferring hospital will be on that CD. That has to accompany your packet to the hospital. Inside this packet, there should be a face sheet for you and an EMTALA form. On the EMTALA form, this is what that looks like. On this form, it is very imperative that you look for these highlighted sections. This is where it lists what is required. If it's required that it be a paramedic, a ground ambulance, an air ambulance, if it's ALS or BLS, if it requires a monitor. You'll also find your doctor's orders on here, so orders for any medication should be listed on here as well. On this EMTALA form, it has to have a date and time and a physician's signature. The last page will have a physician's signature at the bottom. It has to have that signature with a date and time, guys. If it doesn't have a doctor's signature, it is an invalid EMTALA, and we cannot take that patient until this is corrected. Again, this is where you're going to find all of the information that you need to take this patient and complete your actions as far as medications, fluid, oxygen, monitoring, how they want the patient monitored, how many vitals they want them, Q5 or Q15. Typically on an ALS IFT, stable patients, I want to see you guys monitoring vitals Q15 minutes. Any changes at all, you get monitored vitals Q5 minutes for at least a half an hour after the change. If the patient remains stable after the change, you can go back to Q15 minute vital monitoring. Hopefully that is clear for everybody. In your PCR, the way we want to see your PCR put together is our ambulance billing sheet on top, the receiving hospital's face sheet, the sending hospital's face sheet, your EMTALA form, and then your PCR attached behind that. Again, our ambulance billing sheet correctly filled out, the receiving hospital's face sheet, the sending hospital's face sheet, and your EMTALA form. All attached in that order on top of your PCR when you turn it in to the office. If you have any questions at all, please contact the on-duty battalion chief or the on-duty captain for clarification. Hopefully this video has helped you guys. Good luck on your IFTs. Have a good day.